Okay, good morning, everyone. Welcome to the Health, Human, and Social Services Committee meeting. We do have enough for a quorum, so I would like to start the meeting by approving last month's committee meeting minutes, please. Motion made by Supervisor Strau, seconded by Supervisor Frazier. All in favor?
Aye.
Opposed? Carried. We have Pat from Public Health.
Okay, good morning. First thing on our agenda is to request a resolution to amend our contract with Kenny Management Service to reflect an increase in the annual cost from $650 to $700 for the period for a year with automatic annual renewals unless the price increases. The price is actually $800, but we're given a $100 customer appreciation discount. It's a software and website license agreement where it's needed as part of our corporate compliance plan, and it allows us to check to make sure none of our providers are on the exclusion list. The cost has not increased since 2011, and the amendment in 2012 was done only to add the clause that automatic renewals can occur as long as the price doesn't increase. Not a high cost situation, but because just due diligence, Tammy did do some research and found out that we can't get any better deals.
Motion made by Supervisor McDevitt, seconded by Supervisor Simpson. All in favor?
Aye.
Opposed? Carried.
Okay, we'd also like to request a resolution to allow Jody Rhines to enroll in a job-related course titled Transcultural Nursing. She's working on her bachelor's. I think this is her last or second to last course. So, if she could get her 50% reimbursement after she completes it with the appropriate grade, that would be good.
Okay. Motion made by Supervisor Simpson, seconded by Supervisor McDevitt.
Can I ask one question, please?
Sure.
What is transcultural nursing?
Basically, it's just talking about all of different, it's like a world kind of transcultural, like we're supposed to be responsive to any culture that a person is.
Okay.
Maybe I don't know if that answers you, but it's just...
I guess, yeah.
I didn't make the course, but it sounds appropriate and it is required for her degree.
Okay, great, thank you.
We'll fill you in after the...
Thank you very much.
I can add them from now on if you want. I can add the course description.
Okay, maybe I shouldn't have asked the question.
Maybe I should have had a better answer. I'll do more homework next time.
Okay, we've got a motion and a second. All in favor?
Aye.
Opposed? Carried.
Okay, we would also like to request a resolution to amend the 2016 budget to reflect the payment of $1,274.37 from an insurance company for repairs to a vehicle, which totaled that amount, and the incident was not our fault, and the insurance company paid in full.
Okay. Motion made by Supervisor Strauss, seconded by Supervisor McDonald. Any discussion? All in favor?
Aye.
Opposed? Carried.
Can I just revisit the college one a minute?
Yeah.
On the college one, there was a email floating around from the treasurer's office, so I think Peter's question should be well taken. You know, even though the board is responsible for okaying this, we got to rely on the department head to make sure that the course that people are taking does relate to their job specifications. So in the future, it probably wouldn't hurt that we had a little bit better explanation on which the course are taking, because you know the ultimate decision lies within the committee and then the board of supervisors. But it has been questioned, you know, if the course is really pertinent to the job. I know they have to stay, you know, 18 months after the job is completed. So
We certainly could do that. I guess my thing is if it was, it's related to a bachelor's degree in nursing.
That's fine.
Those kind of people are not easy to get.
But I caution the committee and the members here that it is important that the board members really understand what the course is about, because there's been questions by the treasurer's office after the fact.
I can certainly do that from now on. We don't have that many people taking courses, but that's an easy thing to do.
I appreciate it.
Yeah, it does say here it's a required course for that degree.
Well, not only that, but I think it's training the nurse how to deal with diversity. And that's one thing we want to be able to deal with. So.
Yeah.
I've not seen, with the bachelor's degrees in nursing, and even though various institutions have little variations on themes, by and large, the overall concept of what they want them to come out with is the same. But that's an easy enough thing to do. It's not like she's getting a degree in something unrelated.
Right. Thank you.
Okay. moving on, we, would like to entertain committee approval to authorize Tammy DiLorenzo, our clinical and fiscal informatics coordinator, to attend the Home Care Association Senior Financial Managers Retreat. This is something that she's done for the past 3 years. They've always held it, unfortunately, at the same place. And I guess it's good that it's not farther down, but it is an overnight stay, and the conferences, as you can see, including meals and travel accommodations, $728 for 2 days. It's a good conference. We really need to be there because that's when they pull out all of the reimbursement information.
Okay, motion made by Supervisor Strauss, seconded by Supervisor Bramer. Any comments on this, Supervisor McDevitt? Go ahead. All in favor?
Aye.
Opposed? Carried, okay.
Okay, we don't have any pending items, so moving on to information for discussion and review. In your packet, there was our emergency response and preparedness report. It's summertime, so there's not quite as much going on as there might be in other months of the year. But if anybody has any questions, I guess we can move on. And there is the rabies program report, attachment number 6. This is a busy-ish time of year. As you can see, we have more bites around this time of year, due in January, February usually. Anybody has any questions? We can move on to status of referrals, attachment number 4. And as you can see from that, we ebb and flow. Last month we were down 13%, this month we're down 7%. Again, we're holding our own. We're busy enough. We still have some open nursing positions, but our per diem is saving us. We're doing okay there. So I don't know if anybody has particular questions. Val can certainly speak to that. Okay. If not, we can move on to expenditures and revenues and overtime and the comparison report. Tom?
Attachment number 2 is our current status of, for the whole, health services revenues and expenses. You will see that we are down almost $127,000 regarding salaries, related to last year to this year. Our, of course, biggest ones right now, we still have nursing positions open, but you'll see that our overtime and part-time is pretty much a wash, because our per diem are helping with that, taking up those times that we needed, and they're also helping, I believe, on weekends, which has helped out, so our overtime is down from last year, which is good, by 22%. On attachment number 3, which is a comparison of last year's this time to this year, we are down slightly in contractual, not slightly, but contractual expenses, where most of it is related to timing of getting billed, and I know our preschool program, we have a few that we won't pay a bill unless everything is right with it, and we've had some that we've held for months just to get everything right. They're being processed now, so that will catch up. And our revenues are down slightly. We don't have our long-term care program again, so I can believe it was in May was our last patient for the long-term care, so you're going to see those, and they, of course, have been going down all year, but long-term care has gone down slightly too. Also, we stated last time with our decreases in some payments for Medicare and Medicaid based on the fee schedule. But overall, I look at the bottom line, our impact to the county, as I've said before, and right now, we're under the bottom line impact that we were at last year. We're at the difference between revenues and was 1.9 for current, and 2.3 we're at last year at this time. So we are down under what we had budgeted, which is good.
Yes.
I was just thinking, time, as far as the comp time, does that have an impact on our overtime? Because we do have a lot of nurses utilizing that on the weekends versus...
Once they use it, I believe it goes to the overtime status, once they use it, yeah.
So that's not counted in overtime, or
If it's been used.
Okay.
If it hasn't been used, it's not recorded. Once they spend their, comp time and they're paid for it, that's when it will show up in our dollar figures. They do have to use it by the beginning of December, I believe, so we try to make sure all those numbers don't get out there.
Okay. Any questions or comments?
We have one.
Yes, Chairman.
Unfortunately. Would you say, Ton, that is the state paying more timely or about the same as they always do, the lag time of getting payments from the state?
It seems like it's been okay, and especially with our EIS pro, that's like every 2 weeks now.
Okay, so,
So, and, they've also, it's kind of ironic, sometimes I get a notice that they're gonna make a payment, and I go to notify the treasurer, and they've already got the payment.
good,
So, yeah, so far so good, even with our preschool program, they're pretty consistent. We haven't seen any holdup like in past years.
good, thank you.
Okay, under other, we've received $9,834 from the auction for the sale of 4 of our older vehicles that went there. And then working with Joanne McKinstry, she's advised that these monies will go back to the vehicle reserve fund and that she's going to transfer some additional funds to allow for the purchase of a new vehicle, and that we didn't need to take any action with a resolution or anything, but we should let the committee know, so the committee is being informed, and if anybody has any questions.
I believe a new car runs around, according to the bid, around 16,000. And I had asked Joanne, because 2 of the cars, there were 4, 2 of them were 2014 cars, they're fairly new, that we lost in the fleet. So, we're getting 2 already on order, but when this gets through, if it's still available on bid, then first come, first served. So, as soon as this gets approved, we will put in the order for the third car. It takes 60 to 90 days for them to deliver it to us, so we'll hopefully get it by the end of the year, but, at least if we could put some money, because I said, once I saw what we were getting from the auction, I said, can we put that money towards the new car?
Sure.
So that's what she suggested, how many can bring it.
Supervisor Bramer?
Thanks. Did we ever hear what happened with those cars that had the bad transmission or whatever it was?
The Fiestas?
Yeah.
They've been fixed initially. We did have problems with one other one that had to go back for a third fixing. But by and large, compared to where we were, we're better. Not great, because the cars you only got what you got to work with, but,
Well, I think what's nice is they are working with us, so
Okay.
that's how.
The DPW is testing them once they come back to make sure that they're okay before we give them back to the nurses.
Mhm. Good, good.
okay, the last thing is just a little informational item on our personnel update. Nursing recruitment continues to remain a challenge. And I did put last week when this information was transmitted, we haven't been able to hire any new nurses, but since then, we did have an interview with one that's looking, very promising, and we're awaiting references, so we will fill that. Like I've said before, maybe we're picky, but I think it's important in the long run to be picky, so we'll wait, and we're lucky enough right now to have per diem that's helping us out.
Good.
That's all I have.
Anything else for public health? Thank you, ladies. Enjoy the rest of the week.
No.
Go to Laconia?
Yeah.
You did?
Yeah. It was good,
Yeah.
good.
Oh, the,
Yeah.
yeah,
No,
I hear you. Pat? Ask Frank what he did. Springtime season.
Could have been cooler.
Oh, I can't, yeah. Yours or mine? I can't do it, I've been, I'm
And I
heading away.
canceled this appointment like 3 times, I just don't feel like I can do it.
Yeah. I was in, Portage all day for the Common Ground Alliance. I was one of the, it was my breakout group.
Maybe to go.
Good, good, oh, really good, yeah.
That takes up all the day for you.
Yeah.
I hear you.
Okay, moving into the social services portion of the meeting. Dee, do you wanna go first?
Sure.
I have a board meeting tomorrow.
The first item that I have on the agenda is permission to amend Resolution 276 of 2015. By doing this, it would allow us to pay time and 1/2 to any per diem employee that works on a holiday, any hours over 8 hours in a day, and any hours over 40 in a week, which would be similar to all the other employees that we have at Countryside.
Good. That kind of policy. Is that a county policy? don't
I
know.
believe so, yeah.
Yeah, I'm not sure.
This is county policy, correct?
Yes, it is a
Yeah,
county
yeah.
policy. I have
mo-
attached that policy.
Motion made by Supervisor Bramer, second by Supervisor Methibet. Yes, Supervisor Bramer.
I guess my only thought is that if these are per diem employees, they are not, wouldn't they be expected, I don't know, to be working holidays and
We can't
Over-
expect them to. Typically, we can schedule them to cover any benefit time that we have, like vacation, personal, or floating holiday. But if somebody calls in sick and say, we can't get any other employees to work it, and they've already worked 8 hours, and they have to stay and work 8 more, they should get overtime just like any other person at Countryside should. And we utilize them a lot, especially most recently, we had 3 people out at the same time on medical leave for over a month. So we had to utilize the per diem quite a bit.
I believe that same thing occurred with the Westmount when we...
It was Westmount.
Yeah.
But,
Go
And
ahead.
they were the exception in the policy, Westmount was.
right, and I'm just a little concerned about this coming through this committee this way without going to finance and personnel to see, I mean, it is a health facility. And I understand that, you know, and if you get a lot of people call off, you're, but I don't know what impact that, Frank, you wanna weigh in on this one, the changes for per diems? Because they'll come everywhere and want a per diem. That's why they are per diem. They work when you want them to, and I'm just a little concerned. I don't know what you feel. Yeah.
And what we could do, I guess, is approve it here at this committee and move it on to personnel, and if there's discussions there, we can have them at that point, but if that's okay with you, unless you have any other...
Is it the law?
It's county policy, I don't know if it's the law.
I don't think it is, I don't think it's a federal law where you pay overtime. I think, it's within 40 hours within a week where you have to pay overtime. I don't think it's on a daily basis.
Right.
I just wanna make sure we're not doing something here that's gonna affect, it won't turn into just, you know, Countryside. If it's just an exemption for Countryside, I think it'll probably work.
And Mary Elizabeth, can you guys look into this, please?
Change it.
And we'll have it ready for personnel, is that okay?
Thank you.
Just so you guys know, this is the way that it had been done previously until this policy came into effect.
Supervisor Beatty, did you have a question?
Yeah, thank you, Mr. Chairman. So, per diem, from my experience, is, not subject to overtime, laws, okay? Henceforth, you know, whether they work 8 hours or 12 hours, as far as I know, when I used to be a little more involved in that a few years ago, it wasn't subject to, the New York State law of overtime. Now, unless that's changed in the last 4 years, which it could have, I can say I'm an expert on that, but, so, I guess where I have a concern then is, if we change this to reflect overtime, obviously that's an additional cost to the county and so forth and so on, and I'm not so sure if we're opening up other doors, in other departments with per diems, and so, I would be, personally, I'd be very cautious on, and I'd probably be against, with any overtime, or, situation that increases the per diem pay. So that's just my 2 cents on that. Thanks.
Supervisor Conover?
Yeah, I was just looking at the wording of this, on the back page to step away. It says, Westmont Health Facility will continue to pay holiday plus time and 1/2. I think what that's saying is that you pay the day rate plus 1/2, so you're paying 2/2 on holiday.
Yes, and we're just asking for the time and a half.
I was just gonna say, I just want the committee to be aware that when you come back to what's being requested here, it's a variance. I'm not saying it's good or bad, but it's a variance from, in other words, the Westmont policy was on holidays. If I'm reading this correctly, and I think I am. A holiday plus time and 1/2, so you're paying 2/2 on a holiday. Some DPWs do that on a holiday. Well, they don't pay time and 1/2, they pay more than that. But the policy that's being requested here is, simply to pay time and 1/2.
And regardless of who works the holidays, they get time and a half, so if it's a regular employee that's full-time or part-time more than 24 hours a week, they're getting the time and a half anyway, so either way, we would be paying out the time and a half.
Well, that's what I was just going to say, we still have to have functionality at the facility, I mean, it's either,
Can, sorry,
go ahead.
can you just give me a little history on what happened? What is the deal with Westmount? Why are we talking about that?
Just because they're written specifically in this policy, when this policy came about, I know we were consulted and I explained how we did it, but we weren't reflected in this statement for. I think we should have been at that time as well, because we are a 24-hour facility just like Westmount is. We have minimum staffing levels that we have to adhere to.
Okay.
And by doing this, it allows us to maintain those minimum staffing levels. And it wouldn't have that much of an impact on the budget, because if we didn't get a per diem to work it, we'd have to use a regular employee and they would get the time and a half anyways.
Right.
And with our per diems, we can't make them work a shift. They have to agree to working it.
Okay, so is the committee comfortable with us moving this on to personnel? Okay, we do have a motion in a second, correct?
Yes.
Okay, all those in favor?
Aye.
Opposed? Carried, okay.
The first item under the referral pending items, we currently have a contract with Warrensburg Laundromat to do all of our laundry services for the facility. It is due to expire the end of August. I have contacted them and they want to increase our fee from 55 cents a pound to 69 cents a pound, which is a 25% increase, which will be an additional $5,000 a year. When I wrote the agenda, I had sent out letters to other companies to see if anybody else would be interested in doing the service, and I have not heard back from any of them. So I don't know if you are agreeable to moving forward with the contract with Warrensburg Laundry as it stands with the 14-cent increase, or if you'd like me to pursue calling the other companies and try and see if I can get a rate from them. It is still less than what we would pay if we had an employee at the facility doing the service.
While you're doing your due diligence, would they be opposed to doing,
Extension?
I'm sorry?
An extension?
Correct. Maybe we pay month by month instead of a full year contract, this way we have maybe a couple more months to explore. Would they be willing to do something like that?
I
mean, at the new rate, obviously, but
I will contact them today to see if they would extend it for a month or two, while I call the other companies. I did give them like a month to get back to me, and the deadline was Monday, and I haven't heard anything from them.
Supervisor Montesi?
What kind of service is it? Has it been good service from?
It has been, yes. Yep. They come and pick up the laundry and drop it off every Monday, Wednesday, and Friday. They do a phenomenal job. They package it, they fold it, everything. We just sort it when it comes back. We do have occasional episodes where something comes back with a bleach stain on it or something that's torn, and in that case, we just replace the item, submit a receipt to them, and they reimburse us.
In terms of 55 cents, how long has that been in effect?
The past 2 years.
Not bad.
And before that, it was 49 cents, I believe. And they stated that the increase was due to the increase in the minimum wage, which increases the amount they have to pay their workers, plus all their product prices are going to go up because of that increase in the minimum wage.
It's true. Supervisor Beatty?
Yeah, what's the total amount that we pay Warrensburg Laundry per year? You said it's going up $5,000 a year if we accept this. So what do we pay now? What do we pay in 2015?
Currently, right now, it's not to exceed $20,000 for the 2015 and 2016 time frame. So it would go up to about $25,000.
So for a 1 year time frame, correct me if I'm wrong, it's $20,000 term.
Correct.
Okay.
Right around there.
I would recommend that we put this out as an RFP. Again, when we've done this in smaller situations, we seem to have a pretty good feedback in saving the county money. So personally, I would be comfortable putting together an RFP and putting this out. If we don't get, obviously, any interest, we don't get interest, but we don't know unless we put it out. I know you personally have touched base with some companies, and that's fine, but I think if we put out a formal RFP, I think we'd have probably some better luck, and we could really get a gauge on really if this is a good deal for us or not.
Supervisor Bramer?
I was gonna comment that I'd like to see if purchasing can help us at all, the purchasing department. I don't know if an RFP is needed, but something to get out the word and just to see if we can get a better rate with some more competitive type bidding.
Absolutely.
If anyone else would be interested.
In the past, all I've done is send out letters to get quotes, and we've gotten responses, but this year we did not, so I'm comfortable with that.
Okay, well, what's the committee's pleasure? We've had a few suggestions here. Are we comfortable with just,
No, I think they should go out and seek other prices for doing this. I agree with what some have said.
okay, so we'll give you a couple, see if they give us a couple months and look at it. Okay?
And number two, we had to replace our condenser unit and fan in the walk-in cooler. We just recently did it in the walk-in freezer. We had to do it in the walk-in cooler because it stopped working. It is the original unit to the building, so they weren't able to get any parts to replace it. It was an emergency. We did have to do it right away, so we went through the county policy, and just to advise you guys that it did cost $5,933.07, and this will come out of our repair and maintenance building code. I'm hoping that we'll be set for the rest of the year and won't have any more expenses. And then the last item is just our overtime report, which if you look at it, we are down, 54.8 hours from last year, so it is very comparative.
Very good. Anything else for Countryside? Supervisor Simpson?
I just, would like to ask how we're doing with the out-of-county,
We have one person that is from, Hamilton County, but she has been there for quite a while. We got special permission to admit her. We do not have anybody new, but we are getting the referrals. Unfortunately, most of the referrals we're getting are people that are too skilled for us. We're still having that difficulty. Even though we're advertising, trying to promote the facility, we still have that,
Okay.
having that concern.
Thank you.
Supervisor Bramer?
Yeah, thanks. I will not be able to make the tour this afternoon. I'm sorry about that.
I was just gonna mention that. I guess quite a few supervisors have been up there already, but we will still hold it if anybody would like to attend.
We'd love to have you come.
Thank you, Dee.
Thank you.
Okay, we have a couple of more items. Obviously, Maureen and Cynthia and a group of others have gone to the annual meeting, so they are not here, but they do have a couple of resolution requests. You do have them, correct?
They're here.
Okay, good. I will read them as follows. The first one being approval from the Chairman of the Board of Supervisors and the Warren County Treasurer for the DSS to submit the application for youth program funds. And this is attachment number 1 in your packet. These are all distributed to all the towns and the city of Glens Falls. It was a total of $55,432. So we need approval for that. Motion made by Supervisor Strauss, second by Supervisor Frazier. Any discussion? All in favor?
Aye.
Opposed? Carried. And the second one is the conference. I did give out of committee approval for this. This is an annual workshop, and it's mostly to those in the supervisory role, so I felt it was very important for them to be there. So they just need final approval from the committee. Motion made by Supervisor Simpson, second by Supervisor McDonald. All in favor?
Aye.
Opposed? Carried. And there were no pending items. Any questions on the attachments that were also given out of revenues and expenditures? And obviously Julie's not here to address those. We do have questions or comments, though. If not, motion to adjourn. Motion made by Supervisor Simpson, second by Supervisor Strauss. All in favor? Opposed? Carried. Thank you, guys.